it just looked ridiculous in there, ridiculously busy.
Tammy Fair was in Royal University Hospital recently to visit her 92-year-old mother who had had a heart attack. She says her mother received excellent care and is back home, but Fair says the space was packed with stretchers and people waiting to be seen.
Every hallway I turned around, there were stretchers with people, paramedics looking after their people on stretchers, and you'd go past some, they looked like they would ordinarily be storage rooms, and they had recliners with people in them. There were people all over, and the waiting room, there were people standing. Every chair was taken, and every corner I turned, I thought, holy smokes, what is going on?
Fair wants to see a solution now, and Saskatchewan Health Authority officials say they're working on it. According to the SHA, there is a surge of patients every fall, but this year has seen extraordinary volumes. Tuesday morning, a plan was announced to address overcrowding.
Regardless of this positive progress we've made, it is clearly understood that more work is necessary. Therefore, the SHA is implementing a number of actions to address the current capacity pressures.
The Saskatchewan Health Authority plans to increase emergency room staffing, add 43 beds at Royal University Hospital, increase the number of long-term care beds, and coordinate better with regional hospitals.
The Saskatoon Capacity Action Plan outlines several measures to provide immediate support for the hardworking health professionals delivering tremendous patient care under very difficult circumstances.
Some of the longer term solutions that the SHA talked about today, and this is what we discussed with them from government, was again, down the road, how do we create that space in the healthcare sector? So does that mean, greater, and I think this was touched on today, a greater utilization of home care, so expansion in home care, utilizing more and creating more convalescent spaces for people, and for those that, as have been identified, alternative level of care, ALC patients. That's some of the 60 to, I would say, up to 90-day solutions, and then there's some longer-term ones as well.
SHA officials say they also want to improve communication with staff to hear their ideas, and they say that if everyone works together, they're confident it will result in better care for all Saskatchewan patients. Jason Warwick, CBC News, Saskatoon.